Okay, let's talk about something that's on a lot of cyclists' minds. We all know cycling is an amazing workout, right? It's incredible for your heart, great for your fitness, and honestly, a lifesaver for mental health. But there's this one question that often comes up, sometimes kind of quietly. Could all that time you're spending in the saddle be, affecting your sex life? And hey, it's a totally fair question. I mean, think about it. You're spending hours, sometimes putting a whole lot of your body weight on a really small and, let's be honest, very sensitive area. So let's just cut to the chase and ask it outright. Can cycling actually cause problems with your sexual health? So here's the short answer. Yes, it can. But, and this is a really big but, the risks are super manageable and totally preventable. I really want to be clear here. The whole point of this is not to scare you off your bike. It's the exact opposite, actually. We want to arm you with the knowledge you need so you can keep enjoying every single ride completely worry-free. All right, so before we get into the nitty-gritty of what could go wrong, let's just hit the pause button for a second and remember why we even get on the bike in the first place. The truth is, cycling is just so good for us. I mean, just look at this list. The benefits are absolutely incredible. We're talking better cardiovascular health, a lower risk of heart disease, it helps manage diabetes, lowers your blood pressure. I mean, the list goes on. It's great for weight loss, it's a massive boost for your mental health, and it's low impact on your joints. The bottom line, this is something we want to keep doing for a long time. So let's figure out how to do it safely. Okay, so what's the actual science here? What's happening down there? Well, it really just boils down to some pretty simple physics and anatomy. It's all about the pressure, specifically the pressure between your body and that bicycle saddle. And the key player in this whole story is an area called the perineum. You've probably heard of it. It's basically that soft tissue area right where your body meets the saddle. Now, what's crucial to understand is that packed into this tiny space is a whole network of really important nerves and arteries. They're the ones responsible for feeling and blood flow in that entire region. So here's how it all goes down. It's like a chain reaction. First, you're sitting on a pretty narrow saddle for a long time. That creates pressure, which then compresses that whole perineum area. And when that happens, a specific nerve, the pudendal nerve, can get irritated and the pudendal artery can get squeezed, which reduces blood flow. And that combo, right there, that's the root cause of all the issues we're talking about. All right, so we know what's happening mechanically, but what does that compression actually feel like? Let's get into the specific symptoms. And again, I'm gonna say this a few times. For the vast majority of people, these symptoms are temporary. And check this out, this number might actually surprise you. We're talking about 30 to 50%. That's the percentage of regular cyclists in some studies who've said, yeah, I've experienced temporary genital numbness. That is a huge number. So if this has ever happened to you, I want you to know you are absolutely not alone. It's a really common side effect of all that pressure. Breaking it down a bit, for men, this can show up as that numbness we just talked about, or even temporary erectile difficulties. For women, it's often numbness in the vulvar area, general discomfort, or just reduced sensitivity. But here's the thing, whether you're a man or a woman, the root cause is exactly the same. It's a temporary disruption of those nerve signals and that crucial blood flow. And this quote right here is probably the most important takeaway from this whole section. The key words you need to hear are temporary and improve when pressure is reduced. This isn't about permanent damage, okay? It's about your body sending you a signal, a little warning light on the dashboard saying, hey, something's not right here. Which honestly brings us to the best part, the solutions. Because this is a problem with a clear mechanical cause. It has, you guessed it, clear mechanical fixes. So let's put together our very own safe cycling checklist. And where do you think we're gonna start? Unsurprisingly, the number one place is the very thing your body is touching for hours on end, your seat. The right saddle can make all, and I mean all, the difference. So the whole goal here is to get your body weight off of that sensitive soft tissue and onto your sit bones, the bony part of your butt that's actually designed for sitting. So what can you do? Well, you could try a wider saddle for better support. You can even look into these noseless designs that pretty much eliminate the pressure on the perineum altogether. Saddles with cutouts can also work wonders for some people, but the key thing here is that it's super personal. You've got to experiment and find what feels right for your body. All right, next up, your handlebar height. This is a big one. Think about it. If your handlebars are really low, like in a classic racing position, you have to lean way forward. And when you do that, your body weight shifts right onto that soft tissue area we've been talking about. But if you raise your handlebars, you can sit more upright, and that automatically shifts your weight back onto your sit bones, exactly where it's supposed to be. And finally, let's talk about some simple adjustments you can make while you're actually riding. Look, your body was not designed to be frozen in one position for hours. So move around, shift your position often. When you're going up a hill or just see a straightaway, stand up on the pedals for a bit. On those longer rides, take a few short breaks. You won't believe this, but some research suggests that just standing up for about 20% of your ride can make a massive difference. Okay, so let's wrap this all up. What are the big takeaways? Number 1, cycling is overwhelmingly good for you. Don't forget that. Number 2, that temporary numbness, it's just from nerve and artery compression. It's a mechanical issue. Which leads to number 3, the solution is not to stop cycling. It's simply to reduce the pressure. And the absolute best way to do that is with a proper bike fit, paying super close attention to your saddle and your handlebar height. So I'll leave you with this one final question to think about. Is your bike set up for your body? Not your friend's body, not the pro you saw online, but for you. It's not a one-size-fits-all machine. It's supposed to be an extension of you. So please take the time to really look at your setup, listen to what your body's telling you, and make those small tweaks, because those are the adjustments that will let you ride happy, healthy, and completely worry-free for years and years to come.